Many people in Cape Coral look forward to their 65th birthday. It is a time when they can finally enroll in Medicare. This is a major milestone. You have worked hard for many years and paid your taxes. Now, you expect this federal health insurance to take care of your medical needs. A common belief is that once you have Medicare, all your hospital bills will be completely paid for. You might think that a trip to Cape Coral Hospital or any other facility will cost you nothing out of pocket. This idea brings a great sense of security to many seniors and their families. Unfortunately, this common belief is not entirely accurate. While Medicare provides excellent and essential hospital coverage, it does not pay for 100% of the costs. This can be a surprising and stressful realization for many people, often at a time when they are most vulnerable, like during a medical emergency. Understanding the details of what Medicare covers and, more importantly, what it does not cover is crucial for your financial health. It helps you prepare for the future and avoid unexpected, large medical bills that can quickly drain your retirement savings. The healthcare system can feel like a complicated maze, especially when you are trying to figure out insurance. The rules and costs associated with Medicare can seem confusing. There are different parts, letters, and plans. Each one has its own specific set of benefits and costs. For residents of our beautiful city of Cape Coral, knowing how these pieces fit together is the first step toward true peace of mind. It's about moving from a place of uncertainty to a position of knowledge and control over your healthcare expenses. This essay will guide you through the essentials of Medicare's hospital coverage. We will break down what Medicare Part A pays for. We will also shine a light on the costs that you are responsible for paying yourself. Most importantly, we will explore the solutions available to you right here in Cape Coral to help cover those gaps. The goal is to give you the clear, simple information you need to make informed decisions about your health insurance, ensuring you are well protected against the high cost of hospital care. When people talk about Medicare and hospital stays, they are usually referring to Medicare Part A. Think of Part A as your hospital insurance. For most people who turn 65, Part A is premium-free. This is because you or your spouse have paid Medicare taxes for at least 10 years while working. This part of Medicare is specifically designed to help cover the costs associated with inpatient care. This includes the services you receive when you are formally admitted to a hospital or a skilled nursing facility following a qualifying hospital stay. So, what does Part A actually cover when you are admitted as an inpatient? It helps pay for a semi-private room, which is a room you share with another patient. It also covers your meals, general nursing care provided by the hospital staff, and drugs that are part of your inpatient treatment. Other hospital services and supplies are also included under this coverage. For example, if you need physical therapy while in the hospital to help you recover, Part A helps pay for that. It is the foundation of your hospital coverage. It is also important to know that Part A covers care in other specific settings besides just a hospital. If you need short-term care in a skilled nursing facility after a hospital stay, Part A can help cover those costs. It is not for long-term custodial care, but for skilled care to help you get better. Hospice care for individuals who are terminally ill is another critical benefit covered under Part A, providing comfort and support at the end of life. Limited home healthcare services may also be covered if you meet certain conditions. Understanding these benefits is the first step. Part A provides a strong safety net for major hospital events. It ensures that you have access to necessary inpatient medical care without having to bear the entire financial burden on your own. However, this coverage is not a blank check. It comes with its own set of rules, limitations, and most importantly, costs that you will be expected to pay. The next section will explore these out-of-pocket expenses in detail, so you know exactly what to expect. Here is the most important fact to remember. Original Medicare does not pay for 100% of your hospital bill. Even with Part A, you are responsible for a share of the costs. These costs come in the form of deductibles and coinsurance. A deductible is the amount you must pay out of pocket before your Medicare coverage starts paying. For hospital stays, this deductible applies to each benefit period. A benefit period begins the day you are admitted as an inpatient and ends when you have not received any inpatient hospital or skilled nursing facility care for 60 days in a row. Let's look at the specific numbers for 2025 to make this clear. The Medicare Part A inpatient hospital deductible is a significant amount, $1,656 for each benefit period. This means if you are admitted to the hospital, you must pay the first $1,656 of your hospital costs yourself. If you leave the hospital and are readmitted more than 60 days later, a new benefit period starts, and you would have to pay that $1,656 deductible again. This can happen multiple times in a single year, and those costs can add up very quickly. The expenses do not stop with the deductible. If your hospital stay lasts longer than 60 days, you will start paying daily coinsurance. For days 61 through 90 of a hospital stay in 2025, you will owe $414 per day. Imagine a prolonged illness that keeps you in the hospital for 70 days. You would first pay the $1,656 deductible. Then, you would pay an additional $4,140 for those extra 10 days, which is $414 times 10. That is a total of $5,796 out of your own pocket for a single hospital stay. After 90 days, you can use your lifetime reserve days. You have 60 of these days to use over your entire lifetime. However, the coinsurance for these days is even higher. In 2025, it costs $828 per day. If you use all of your lifetime reserve days, you will be responsible for all costs from that point forward. These numbers show that a serious illness or injury could lead to devastating hospital bills, even with Medicare Part A. This financial risk is why it is so important to consider additional insurance coverage. Since Original Medicare, that's Parts A and B, leaves you with potential out-of-pocket costs, there are other insurance options designed to fill these gaps. Two of the most common solutions are Medicare Advantage plans, also known as Part C, and Medicare Supplement Insurance, which a lot of folks call Medigap. These plans are offered by private insurance companies that are approved by Medicare. They provide different ways to manage your healthcare costs and get more predictable coverage, which honestly is a huge relief for many seniors living on a fixed income. Medicare Advantage plans are an alternative way to get your Medicare benefits. When you join a Medicare Advantage plan, you still have Medicare, but your coverage comes from the private plan instead of the federal government. These plans have to cover everything that Original Medicare covers, and many offer extra benefits. For example, a plan might include prescription drug coverage, which is Part D, along with vision, dental, and hearing benefits. In terms of hospital costs, a lot of Medicare Advantage plans set a specific copayment for a hospital stay, like a few $100s per day for a limited number of days, instead of that big Part A deductible. Now, Medigap plans work a bit differently. They're not a replacement for Original Medicare. They work alongside it. As the name suggests, Medigap policies help pay for the gaps in coverage, like your Part A deductible and daily coinsurance. For instance, if you have a Medigap plan, it could pay the $1,656 Part A deductible for you when you are admitted to the hospital. It can also cover the daily coinsurance for those longer hospital stays, which really protects you from those mounting costs. This gives you predictable expenses and, peace of mind. Choosing between a Medicare Advantage plan and a Medigap policy is a big decision. Medicare Advantage plans often have low or even $0 monthly premiums, but you may need to use a certain network of doctors and hospitals. Medigap plans usually have higher monthly premiums, but they give you more freedom to see any doctor or visit any hospital in the country that accepts Medicare. The right choice for you really depends on your budget, your health needs, and how you like to access medical care. Navigating the world of Medicare can be pretty overwhelming. With so many plans and rules, it's easy to feel lost. This is where having a local, trusted expert on your side can make all the difference. For folks living in Cape Coral, LP Insurance Solutions provides exactly that kind of support. They are independent insurance agents who specialize in Medicare. Their job isn't to sell you just one product, but to help you understand all your options so you can pick the plan that best fits your personal situation and budget. The team at LP Insurance Solutions really understands the local healthcare landscape here in Lee County. They know which Medicare Advantage plans have networks that include your favorite doctors at Lee Physician Group or your local hospital. They can explain the fine print of different Medigap policies and help you compare costs and benefits in a way that's simple and straightforward. This kind of local expertise is honestly invaluable. Instead of calling some national hotline and talking to a stranger, you can actually sit down with a neighbor who genuinely wants to help you find the right solution. And working with an agency like LP Insurance Solutions doesn't cost you anything. Their compensation comes from the insurance companies, not from you, so you get unbiased advice that's totally focused on your needs. They can help you review your current coverage, especially during the annual enrollment period each fall, to make sure your plan is still the best fit for the coming year. And as your health needs or financial situation changes, they can help you adjust your coverage, so you're always well protected. The most practical step you can take to manage your future hospital bills is to get expert help. Don't try to figure it all out alone. By reaching out to LP Insurance Solutions, you can gain clarity and confidence. They'll walk you through comparing plans, checking for your doctors and prescriptions, and enrolling in the coverage that will help minimize your out-of-pocket costs. This kind of professional guidance is your best strategy for making sure a hospital stay doesn't turn into a financial crisis, so you can really enjoy your retirement here in sunny Cape Coral with true peace of mind.